This is Dr. Anna Maria Mihalcha, President of AM Medical LLC. This is part 2 of the Environmental Health Lecture series, Effects of Heavy Metal Burden, the Causation of Chronic Disease and Treatment. We're going to review the studies that are related to different heavy metals and what they're causing in the body. This particular study discusses blood lead, blood pressure, and high blood pressure in perimenopausal and postmenopausal women. And what has been shown that in these 2,165 women that were aged 40 to 59 years who were found to have elevated blood lead levels, that was correlated with an increase of the systolic and diastolic blood pressure. It has been also shown that the lead induces the high blood pressure as well as acts at multiple sites in the cardiovascular system. So there are direct effects on the excitability of the heart, so that's the electrical system of the heart, and the contractility of the heart, which is how well it's pumping. There's alterations of compliance of the vascular smooth muscle tissue. That means the ability of the smooth muscle to adapt to different volumes of blood that are being pumped through it. As well as there is an effect in the brain that is responsible for blood pressure regulation. So lead causes an increase of blood pressure, but also changes in the heart. Then it's also been shown that the kidneys that have a major part in controlling blood pressure through this renin-angiotensin system are involved because lead is toxic to the kidneys, and it appears that that's another pathway of how lead has been associated with high blood pressure. The low-level environmental exposure to lead has been associated with chronic kidney diseases. In this study, it's been evaluated whether or not the low lead body burden accelerates kidney toxicity and chronic kidney failure in patients who were not diabetic. In 108 patients, they were treated with chelation, and one group was not treated with chelation therapy. And what occurred was that the chelation group had a less rapid decline of kidney failure, and that was measured in the glomerular filtration rate. That's a marker for how well the kidneys are able to filter. So what this indicates is that the lead that was not removed in the control group was progressing the kidney disease further and more rapid. And the group that did not receive the chelation had a up to 4.6 milliliters per minute reduction in filtration ability. So if you talk about roughly 5 mils per minute, that means that within several years you have quite the progression of kidney disease towards end-stage renal disease. There is evidence that lead inhibits the nitric oxide formation. So lead exposure has been absolutely associated with cardiovascular risk, and it is thought that, at least in part, it is related to oxidative stress. Oxidative stress creates free oxygen radicals, and that damages DNA, but also that nitric oxide is specifically depressed or reduced. In this study, it was investigated in 30 men and 32 women who were exposed to lead. There were different concentrations taken in regards to the nitrates, nitric oxide metabolites, and there was significant findings that showed that lead exposure reduced nitric oxide production, and that appears to be one of the significant mechanisms of how lead increases cardiovascular risk. This study shows that lead exposure historically is linked to 256,000 premature deaths from cardiovascular disease in adults in the United States each year. The study of the third National Health and Nutrition Examination Survey, in which 14,289 people that were 20 years or older were followed over a prolonged period of time from 1988 to 2011. What was found was that those people who had high lead levels were at 37% greater risk of premature death from any cause, 70 times greater risk of cardiovascular death, and double the risk of death from ischemic heart disease, so that's your congestive heart failure, compared with people that had lower levels of lead in their blood. This is part of the study that was published in Lancet Public Health. It correlates low-level lead exposure with death in the United States adult population. And it says there that low-level environmental lead exposure is an important but largely overlooked risk factor for cardiovascular disease mortality in the United States. Obviously, this is not something that you commonly discuss with your regular healthcare provider, but it should be. Low levels environmental exposure of lead was unmasked as a silent killer. Despite a 75% reduction in blood lead since the 1970s, which, remember, there used to be lead in gasoline, and there were tons, millions of tons of lead expelled in the air during that time that people inhaled and then deposited in their bones, since lead has a half-life of 30 years. So there was a substantial reduction in the blood levels after lead was taken out of gasoline. However, 38%, that's almost 40% of the U.S. adults have a blood lead level 2 micrograms per deciliter or greater. And remember that anything above 1 already increases your risk of death substantially. There is a 151 to 248% increase in death from stroke 88 to 189% increase in death from heart attacks, and a 25% increase overall death rate. That is why lead is called the silent killer, because you don't feel it, it just continues to create problems in your body. This is the TACT trial, the effect of disodium EDTA chelation on cardiovascular events in patients who had a heart attack already. It was done with the team of Gervasio Lamas. He is the chairman of medicine and cardiology, Columbia University, and this looked at 1,708 patients that were 50 years or older who had a heart attack, and they received either 40 infusions of chelation with vitamins or without vitamins, as well as there were a placebo group that didn't receive the EDTA chelation. This study was a groundbreaking study, and the results were quite significant. There were two groups of people who had beneficial effects, those who were non-diabetic and those who were diabetic. Patients with diabetes had a 41% reduction in cardiovascular endpoints, which means heart attacks, strokes, any type of events that pertains to the cardiovascular system. And they had a 43% reduction in total mortality. And the numbers there say that over a period of 5 years, you would have to treat 7 people to prevent 1 adverse event. That is a very good number, and I'm going to show you a slide that compares that to other treatments. In non-diabetics, there was a 26% reduction in cardiovascular events. So if we compare this to commonly used heart medicines, aspirin has a 25% reduction of cardiovascular events, but if you look, you have to treat between 25 and 50 patients for 2 years with aspirin to prevent 1 adverse event. Beta blockers, those are like your metoprolol, atenolone, have a 23% reduction of events, but you have to treat 42 people over 2 years to prevent 1 event. Cholesterol medication, statins, have a 21% reduction of cardiovascular events, but you have to treat 33 to 65 people over 2 years to prevent 1 adverse event. ACE inhibitors, that's your lisinopril, or ARBs are like losartan, very common medications, 19% reduction in cardiovascular events, but you have to treat 28 up to 200 people to prevent 1 event. Chelation with vitamins in non-diabetics had a 26% reduction of cardiovascular events, so better than aspirin, beta blockers, statins, ACE inhibitors. The chelation in diabetics had a 41% reduction of all cardiovascular events, 51% of myocardial infarction, and 43% of all-cause mortality. So the results comparatively are extraordinary. This was a publication looking at how the immune system is affected by heavy metals, and that the possible consequences of how the immune system is altered could induce autoimmune diseases. So it's been shown that there's a contribution of heavy metals for allergic diseases. Obviously, we know about things like nickel allergy that causes eczema. There are studies which show that heavy metals play a key role in the exacerbation of several autoimmune diseases, and that it appears that the mechanism is through the alteration in the immune cells, Th1, Th2 reactivity is changed. If you look at rheumatoid arthritis, this is a publication in a Pakistani population. In 100 rheumatoid arthritis patients that were analyzed for cadmium, chromium, lead, and nickel, their levels compared to healthy controls of these heavy metals was significantly elevated. The conclusion was that heavy metals may contribute towards the development of rheumatoid arthritis. In macular degeneration, a Korean study showed that toxic heavy metals like lead, mercury, and cadmium negatively influence particularly late macular degeneration, and lead affected adversely early and late macular degeneration. Mercury also has been shown to increase inflammation and autoimmunity. We know mercury exposure from amalgam dental fillings, but also from fish consumption and other environmental sources that I discussed in part 1. This particular study discusses how there's multiple pathways in which autoimmunity and immune dysfunction is induced through the mercury heavy metal exposure. This study shows the correlation between heavy metal exposure and metabolic health by altering the gut microbiome and the metabolites produced by it. The exposure to arsenic and cadmium is common. Here it is looked at that heavy metals can cause metabolic health problems, including type 2 diabetes, and that there is a hypothesis that type 2 diabetes could be occurring because the gut microbiome is altered and the metabolites that this altered gut microbiome is producing. In this case, it is looked at how these metabolites are affected, and it's been shown that arsenic and cadmium exposure cause significant changes to the gut microbiome, and thereby the metabolome, meaning all of the mediators of metabolism, by affecting bile acids, amino acids, and other elements that are associated with our metabolic health. Chronic fatigue is associated with high heavy metal burden. This is a case study that showed improved chronic fatigue symptoms after removal of mercury in a patient with increased mercury concentration. There was a hair toxic mineral assay done. The hair test is no longer recommended by leading authorities. However, in this particular case, what occurred was that the individual developed chronic fatigue after ongoing mercury exposure, as well as weakness, headache, poor memory and concentration difficulty. This is a very common pictures where people have, through chronic exposure and deterioration of their mental capacity and neurological abnormalities. In this case, the mercury concentrations in the body were assessed and then removed, and the patient symptoms of chronic fatigue were improved. This is a Chinese study that looks at mortality due to long-term heavy metal pollution. Obviously, that is quite the issue in their population. This was looked at the heavy metals in environmental samples like the water and the crops, as well as the whole blood of 1,152 residents, and it was shown that there was significant increase of mortality, meaning death rates from cardiovascular disease compared to areas that didn't have such high level exposure. Also, there was a significant correlation between cadmium and lead and a higher risk of dying from cancer among women and for both male and females combined. So their conclusion was that the long-term environmental exposure to cadmium and lead is associated with an increased risk of cardiovascular disease, all types of cancer death rates, and it appeared that zinc exposure might have provided weak protection against dying from cardiovascular disease. Metal toxicity has also been linked to Alzheimer's disease and neuroinflammation. We discussed mercury. In this case, other metals are exposed like lead, aluminum, and cadmium. They affect brain physiology and the immunity of the immune system. And neuroinflammation is an important way in which the cognitive function of people is altered. So this is discussing Alzheimer's in particular, and it showed that there was a correlation in terms of the accumulation of the toxic protein species like the beta amyloid and the tau protein, which are correlated with the progression of Alzheimer's dementia. Heavy metals have been linked to cancers: arsenic, cadmium, chromium, nickel. There are studies that certainly have shown in workers who've been environmentally exposed to high levels of these heavy metals that due to the fact that there are disruption in the tumor suppressor genes, so the genes that are supposed to prevent cancers from arising, they are debilitated by these heavy metals, and there's a damage to the repair process in the cells, and then there are enzymatic activities that are affected. And this oxidative stress via the free oxygen radical species can damage DNA, and when we have then gene mutations and DNA damage, cancers occur. So there's a correlation between heavy metal exposure and DNA damage and the onset of cancer. This shows how arsenic is affecting the cancer risk, leading to DNA damage, cell death, cell damage through oxidative stress, and that multiple cancers have been associated with this, like prostate cancer, cancer of the skin, leukemia, cancer of the liver, through these different gene mechanisms. Cadmium also has been shown to increase cancer risk and cause many different problems like iron deficiency, fractures, liver lesions, bone lesions, kidney injury, kidney dysfunction leading to chronic kidney disease, osteoporosis, and through the process of DNA damage to the generation of radical free oxygen species, oxidative stress, cell death, all of those different pathways, cadmium is affecting and increasing cancer risk. Chelation of heavy metals occurs naturally in the body. We discussed briefly glutathione. There is intracellular antioxidants that are endeavoring to protect the cells, but at some point these heavy metals are actually binding to different pathways intracellularly and deactivating the ability of the cells to protect itself against free radical oxygen species. And so the antioxidant properties that are protecting the cells are no longer available, and there's continuous cell damage. And this problem then continues and leads to more rapid aging, diseases that occur, hormonal disruption, and many other pathways in which these heavy metals are causing illness. This brings me to the end of part 2 of this lecture series. I hope you enjoyed this education. As I discussed before, I think that environmental health is an absolutely important aspect that we need to consider for our longevity. If we have these heavy metals in our body and they are disrupting the functioning of the cell, oftentimes, unless we intervene in that mechanism, it is challenging to, for example, age reverse someone or help them heal from their disease. This sheds new light in terms of what we should be aware of in our environment, and how we should be addressing certain things like how can we remove ourselves from these toxic heavy metals by action, like getting amalgams removed, decreasing the intake of fish with high mercury content, decreasing the intake of high arsenic foods, and other substances that can affect us. People are affected in different ways depending on their genetics, on their propensity, their susceptibility, their bioaccumulation, meaning how much they have been exposed, but then also each person individually is different in what they can tolerate. If you would like more information, you can contact us at the telephone number described here. You can follow us on Facebook and YouTube, and our website is ammedicalmd.com. I hope you enjoyed this education. Thank you.